So hello and welcome everyone to the presentation, Cybersecurity in Healthcare. My name is Dr. Lisa Bichok and I'm a nursing faculty at Southern New Hampshire University. SNHU is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. This educational activity does not include any content that relates to the products and/or services of a commercial interest that would create a conflict of interest. No commercial support has been received for this event. First, a few housekeeping items. During the presentation, the chat box, microphones, and cameras will not be available. There will be about 10 to 15 minutes at the end of the presentation for question and answers with our presenter. Once the Q&A portion of the presentation begins, the Q&A can be used for questions. At the conclusion of this webinar, you can access an evaluation link within the continuing education platform. In order to receive the contact hour for attending this presentation, you must complete the evaluation by October 19th. And next slide, please. So now I would like to introduce our presenter, Joe Santangelo. Oh, I knew I was going to mess it up. I'm sorry.
That's
John.
okay.
John is an experienced caregiver with over 24 years in IT leadership positions, and he's very passionate about improving patient care through modern technology. He is focused on maximizing EMR technology in successfully transitioning to a value-based care delivery model. He believes in growing telemedicine and distance health technologies to achieve financial and clinical efficiencies driven by our current healthcare system transformation. John spent the first 21 years of his healthcare IT career at the Cleveland Clinic, where he oversaw all IT operations for their Florida locations and was also responsible for enterprise-wide growth initiatives and all regional hospital IT operations. John came to Dell Medical School in 2017 with a focus on building a team and culture within IT that meets the demands and goals of our current value-based care healthcare model. After spending a year in Austin, Texas, helping build an IT team for the Dell Medical School startup, John returned home to South Florida and his leadership role with Cleveland Clinic, Florida, to help lead several major growth and acquisition projects. This growth includes leading the integration efforts for Florida in bringing both Martin County Health and Indian River Health Systems into Cleveland Clinic. This acquisition consists of 4 hospitals with over 800 beds and 60 plus various freestanding ambulatory centers, urgent care, and ambulatory surgical centers. While technology plays an important role in modern healthcare operations, John believes the qualities and culture of the IT team working collaboratively with clinical and operational caregivers across the health system is the secret sauce to successfully allowing technology to improve the quality of care for the patients we serve. John received his MBA from Nova Southeastern University, School of Business and Entrepreneurship, and a BS in Health Service Administration from Barry University. Welcome, John. We're so happy to have you tonight.
Thank you so much, Lisa, for that introduction. It's been an exciting journey. I realize in hearing that how much time has gone by. When I started, back in '96 with the Cleveland Clinic, technology really had very little impact on patient care. And, having gone through the transition to EMRs and really just, technology overall really combining and becoming so critical in the care of patients directly related. And I'll talk about it in the presentation on cybersecurity because it's a big piece of it, but it's, it's really been exciting seeing a technology kind of just transition to become so align with the caring of patients. And, when I started, I soon after, working in healthcare, I knew it was going to be where, I was going to make my career. I didn't know I'd be as blessed to be with organizations like Cleveland Clinic, and though it was a short run, it was very exciting out at the Dell Medical School as the CIO, first one for that organization, and starting up a team. So it's been great. It's been exciting seeing technology come into play. And like I said, when I early on, I kind of connected just a little bit we were able to do with technology in helping doctors, nurses, clinicians, care for patients, and seeing that direct connection that I could make really, made a difference to me. And I got lucky really in that, technology really became so dominant in healthcare. And today, and we'll talk about it a lot in the presentation today, with cloud technologies and AI, artificial intelligence, machine learning coming into play. It's just, an amazing transformation that I've been a part of, and been, blessed to be part of. And, I certainly commend all of you students that are pursuing, your education in informatics, or any really area of IT in healthcare, regardless of the class you're in. You may, once you get started, I've seen a lot of people veer off in so many different directions. It's become such a broad scope of career opportunities in healthcare. But certainly nursing has been, someplace that I would say that over 90% of my EMR clinical analysts that work on our EMR at Cleveland Clinic, we use a system called Epic, which is one of the bigger ones out there. Epic and Cerner are two leading EMR technologies. And most of the analysts that work on my team were former nurses that transitioned into the IT world by being exposed to the technology and really grasping it and wanting to make a career out of it. So certainly, for any of you going in that direction, it's a great area that's certainly in high demand, and it gives you an opportunity to kind of pick where you want to work. You can really, if you get into consulting, you can travel a lot. So it's great that you're pursuing, a career in the field. And hopefully today I'll talk a little bit about, the importance of cybersecurity. And it's something that really is important to, really your personal lives. A lot of the things I'll talk about, they really carry to home as well, and being careful, and emails and things like that. So if we can get started, you can go to the first slide, Michael. So this is just talking about the outcomes. What you'll hopefully get out of this is better understanding of cybersecurity's role in healthcare, recognize cybersecurity impact on healthcare, and then be able to describe at least one change in daily practice that relates to cybersecurity. And we'll talk about all of that in detail during the presentation. So hopefully you'll enjoy it and take some good information out of it that'll apply to your either current job or future jobs, or personal use of different technology at home. So we can go to the next slide, Michael. Thank you. So, it's as simple as really, a good example is, a malicious email comes in. So somebody gets an email in their mailbox that has a link in it or an attachment that, looks legitimate. It's amazing how the cyber attackers have, been able to make their emails look legitimate, like it's coming from your bank, or it's coming from internal, from your company. It has your company logo on it and things like that. But, you've got to learn to look at emails, and especially links, what they're asking you. In other words, a bank is never going to ask you for certain information. They're not going to ask you to reply to an email or click a link to, put in certain information that's, private. They've got their website, and you want to, be able to look at those emails, look at the address it's coming from. That's one of the, main things you can do even in your personal life, is look at that address and make sure it looks like, the company address. If it's, something from an organization like Cleveland Clinic, it should say, at clevelandclinic.org, or or .com, or something that got Cleveland Clinic's name in it, not some long address that has a RU at the end of it, which is common for something that's coming from another country, such as Russia, which is Russia and China. I was just watching the news before joining tonight, and they had a segment on cybersecurity and how it's growing in awareness, how everyone is becoming more aware of the threat of it, and how Russia and China are two countries that are really the biggest threat. So you can look at those links in that email, but to just give you a journey of how how you can be impacted by loose cybersecurity within your organization, is an email comes in, you open that attachment, it may end up being a document or an image or something that you don't understand it, but you close it. But what's happened is, once that email is open, then it there's a very good possibility that something was put on your computer that you don't know about, that basically could sit there for a length of time. So a lot of times you won't know yourself as soon as you open something that it's done something malicious. It could be something that's looking to get into your network. The easiest way in nowadays isn't by hacking someone's password, and that it's by what's called these email or phishing attacks, is what they're called. You see a little fish hook on the top there. That's really the most common way that attackers nowadays are getting in to systems, to to companies, by getting in through an email link that's malicious, and then they load something in there that could sit for a length of time, but it goes unnoticed for, it could be up to 4 or 5 days maybe. Go to the next slide. So after a length of time, once that system is set to trigger, all of a sudden things start happening within the environment that you're working. It could be something that attacks the internet access, so you're not able to communicate outside, and then it turns into, it starts affecting your wireless network. And then most of the ransomware attacks, which I'll talk about in a little more detail, but the main attacks that are going out now are they're getting into your system through a malicious email, and they're planting some software on the computer that's got access to your network, and they're propagating, and they're getting into in a healthcare environment, they're looking to attack the EMR primarily. So they're looking to get into that system that holds your lifeline, which all your patient information, certainly if you're in a even a smaller mid to larger scale system nowadays, you're converted to some type of an EMR, maybe cloud-based if you're in a smaller system, or if you're in a bigger system like a Cleveland Clinic, in that where you have a large in-house system, it's susceptible to attack. And if that gets attacked, basically all of a sudden you're starting to have effects on the environment, and within a certain length of time it starts doing things to the day-to-day operations of that hospital. So a clinician struggles with downtime procedures. So if you work in healthcare, if any of you are in healthcare today, that if you're using an EMR, you have downtime procedures, and they're good for a short period of time, but they're not really set up to handle downtimes that are potentially going multiple days. So you struggle with those. Clinicians struggle. You're not able to get your appointments scheduled. you're not able to get, all kinds of activities that you're relying on taken care of. So, clinicians are unsure about what's happening. They struggle with the communication with their patients. All the different aspects of your, care delivery are compromised by, just the lack of being able to receive labs in a timely way, or, have the correct medication list available for your patients, right? Those are all things that have an impact once, once a malicious attack has occurred in your environment, and it becomes really a major distraction to the day-to-day operations of an organization. Go to next slide. So, what happens? What are some of the results? First off, if you're, what's happening nowadays is pretty much ransomware. So, normally the organization will engage with, a public entity. The FBI has a group that really works specifically on things like this, but you'll get, someone to contact the attacker and potentially, start negotiating, because what they usually do is they encrypt the data. So they basically scramble the data so you can't read it. And they basically, give you a dollar amount to pay to release it. And, it's something that a lot of organizations have succumbed to. A lot of hospitals' systems have been, caught up in it. And it affects the financial performance of the hospital, right? So once your system is attacked and you're not able to function the way you can, in a normal environment where you've got the systems talking to each other, you've got access to your email, your EMR, all of your integrated systems like lab results and things like that. It affects your finances. Let's face it, most organizations that have gone under attack have paid the ransom because the financial impact is just, astronomical to them, as well as the impact on hospitals and just patient care. So, hospitals have to cancel surgeries in situations where, they've gone under attack. It really, impacts the healthcare environment totally, let alone that, if they have your data and they're threatening to release it, it's your reputation as far as, having information exposed to your patients that is detrimental to the reputation of an organization, which can be, even worse than the initial financial impact of going through, the downtime of, being basically, your system's corrupted like that. And if you don't have, certain security measures or backups, and a lot of times, that you rely on tape backups, and those aren't always, accessible. They can take days to recover. You can get, errors in it. So, backup systems in a lot of organizations are not true, shadows of the system. And if it's internal to the network, they're under attack by that ransomware software until either you pay the fine and the ransom, releases your product back to you and you get to go back to business, or, you go through some form of a rebuild where, hopefully you have some of your patient data somewhere. But a lot of organizations don't have it to the ability of where they can really bring the full system back to an operational status when it's, corrupted in the way that they basically corrupt your system with a ransomware attack. Nowadays it's really tough. And, there's things that you can do, like having an offsite facility that's separate from your main data center that keeps a copy of your system, but that's really expensive. And a lot of healthcare organizations don't have the, resources, or they haven't, put the resources in to, to protect the systems to that level. And that's where, it really can impact your, operations, your finances, and your ability to care for your patients. Really, it becomes very, very, that, you know, your whole system gets in a disarray over the attack. So next slide. So in this slide, it really, hospitals embrace digitalization, the obligation to protect patient safety, privacy, and availability of care. We're exposed to a rapidly evolving threat landscape, increasing our risk profile year after year. So, you know, like when I started in 95, 96, you had non-connected devices and paper records. So, you know, you know, your images were done standalone, you know, manner where they weren't connected, they weren't digitized yet. They were, you know, films that got loaded and you know, viewed. You would have to send those, you know, images, would print out copies, and they'd go as part of the paper chart, you know, for physicians to look at. But, you know, come into 2005, and when Obamacare really, you know, started to kick in, which is, you know, around 2010 or so, you know, EMRs really started gaining a presence in systems because of the government, you know, incentivizing organizations to do it. You know, we started earlier than the Obamacare, so we started in around 2004 or so. With Epic, because we had a CIO at the time that was very much a visionary and saw the direction of healthcare and saw the, you know, the advantage of having that information, you know, move from paper to computer systems or digitized. And you know, it really was very insightful, and having, you know, choosing Epic way back then was, you know, was a insightful pick of a right vendor, as Epic, you know, was able to grow and really become, you know, a dominant system out there that, you know, was really global. But, you know, for around 2005, you started getting connected devices. So you started getting EMRs, you started getting digitized images in your, you know, radiology systems. You know, once you had EMRs, you started, you know, having lab systems that were able to send data to EMRs, you know, and have that data in one place. So, you know, and then you move into today, 2021, where we're, you know, in a cloud environment. We're very mobile. You know, I was talking before we started on how, you know, my group, a lot of my employees, the folks that are analysts that work on the computer systems, the software side, so the EMR, you know, specifically, they've all transitioned to work from home now, you know. So, you know, a lot of organizations through the COVID impact have moved to, you know, remote models, and that presents, you know, different opportunities of, you know, how you have to engage, you know, your cybersecurity teams to make sure your environment is protected, because you've got people working from home, you've got systems that live in the cloud now. So, you know, difference between having something up in the cloud is you're really relying on that cloud vendor to maintain the security of your data. And that's, you know, something that's been a slow move in healthcare because of the concern of not being able to necessarily protect that data, you know, through your own internal controls, that you're susceptible to, you know, someone getting into that cloud, or people that work for that company that manage the cloud may have access into your system, and it can be compromised that way. So it's definitely, you know, raised a big concern. And then, you know, virtual care now with the COVID, you know, pandemic really, you know, I think if I could say a good thing that came out of COVID was recognizing virtual care and how telemedicine has a place, you know, in our environment, and how it's really a better way to care for certain conditions, you know, certain people that are very mobile. You know, we have a world now where, you know, both parents work, and, you know, a situation where, you know, someone's driving one of their kids to school and notices something in their eye now, nowadays they can get on an app and connect to a provider that can give them a diagnosis, by the technology on your phone, being able to look at the camera, look at your eye, and be able to, prescribe something that you can go to your local drugstore and pick it up. And you don't have to go through the time and the hassle of booking an appointment and going into a brick and mortar facility. Maybe you're sick with something and you're going into a facility, and other people there are susceptible to your sickness if it's something that can be transmitted. So there's lots of reasons why telemedicine and distance health are really taking off now, and I think that is a good thing. But it opens up opportunities for more exposure to your systems being compromised at different levels. So everything from, and we'll talk about it in a future slide, but implants now are smart, right? They're the people have implants that are Bluetooth connected. So when you come into your doctor's office, they may connect to it via computer, where the systems that upgrade it are loaded from the computer onto the device. And if that's compromised, you can't get your internal pacemaker potentially upgraded, or it can be attacked. There was a TV show recently that had a scenario where an implanted pacemaker was hacked into, and they were basically holding that person ransom for releasing the device from their control. And it's not that far-fetched with things moving to mobile and smart technology nowadays. So next slide. So one of the things that's really been was a surprise to me when I first learned it a few years ago, and I imagine that it's growing even more, but the price of EMR data, your medical record more or less, is worth 10 times that of a regular, your credit card, your social security number, a standard, compromise of your personal data, because, there's other money to be made through things like insurance fraud, Medicare fraud, HSA, right? I'm sure, many of you have HSA accounts where you have money that's not taxed that can be used towards healthcare. And those, live in big depositories that, are susceptible to being attacked. Prescription drug fraud, and then just identity theft in general is part of it. So there's so much more exposure in healthcare data, and the value of it again is 10 times that of personal data. So it puts more on organizations to protect that data, because there's the people are after it much more than ever before. So it's something that organizations have to be aware of. We can go to the next slide. So some statistics from cybercrimes grows significantly during the pandemic, with an increased focus on ransomware in healthcare. There's over 560 healthcare facilities were hit by ransomware in 2020. I know many CIOs out there and executives in other systems that were part of these ransomware attacks. And let me tell you, it really shut them down to where they were closing hospitals. They just couldn't, provide service, because without, the downtime processes that I spoke about before, they're just not up to handling, multiple days of being down. They're really there for short downtimes where, you can get a printout of your patients in a hospital, their medications, lists and things like that. But, as their care continues, that information that's part of a downtime procedure is no longer valid, and it becomes impossible to care for them. $4.2 billion plus officially lost from cyber attacks in 2020. Just think about that, $4.2 billion that was paid in ransomware attacks to, and a lot of that was healthcare related. There were some other attacks. There was a big oil company recently that basically controlled pipelines that was shut down recently, and they had to pay, I think, about 4.5 million in ransomware to get their systems back operating. There's a lot of that, you don't even know about. I wonder, with the recent Southwest, down, or a lot of flights getting canceled. Excuse me. I sneeze there. You wonder how much of that could be related to a system issue that could be related to cyber attack, but it's not made public necessarily. So there's just a tremendous amount of dollars out there for hackers and ransomware groups to basically make in launching these phishing emails that get in. And once they're in, and once they basically proliferate a system and they get into that core EMR, in our scenario with a hospital here, it really becomes, just detrimental to that organization's ability to do business. 30% increase in healthcare breaches just in 2020. And I am assure you that that's probably grown more in 2021, just because more and more threats are out there, and people, organizations aren't necessarily addressing cybersecurity with the right financial capital expenditure that they need to. It's getting a lot better, and I certainly know, organizations like mine have invested a lot in a cybersecurity environment, both personnel and the technology itself. So we're pretty protected, but it's, you can never be fully protected, because once someone gets in via an internal, email or something like we spoke about, it gets in through your internal system that already has connectivity, they can do a lot of damage, even with all of the threat detection and cyber, technology, this security technology that's deployed today. And, so talking about healthcare, the last stat there, 40 million plus patient records were exposed as part of, cyber attacks. So, that has such a big impact. I can't stress how that impacts the, the reputation of an organization. I mean, let's face it, if you were, using an organization that you found out that they got their data compromised and your data was exposed, would you continue to go to them? You probably wouldn't, or you'd, certainly give another organization in your local area a chance, more than you would have before that happening. So it has a tremendous impact on, organizations, and the need to protect the data is just so critical in healthcare today. Most organizations have cybersecurity teams now that are specifically dedicated. And like in our environment, a lot of groups, like the people that provision accounts, moved under cybersecurity, because creating accounts is something that fits it. You've got to make sure that accounts are being created correctly, that you're not getting accounts created that are random accounts, or sort of general accounts that can be used. A lot of organizations, they'll have accounts in the past where you can log in using a simple phrase and then a common password that's shared to get into conference rooms and things like that. But that's been locked down a lot now. And there's ways to support it. We have it through technology where we can do it, where we only allow that certain account to work in a conference room where it's tied to the computer in that conference room. So there's ways through cybersecurity that they're helping to make life not harder for you necessarily, but there's a lot of ways that cybersecurity has impacted our ability to do our jobs, but it's for the better of the organization. We need to realize that, and understand that protecting that patient's record, that information is key to anyone that works in healthcare, and protecting the systems from this type of attack is really super important. So some really eye-opening statistics, I think, just when you're looking at 1 year in time. And I imagine, if we came back after this year, these stats will be updated and they'll be even larger. So it's scary. It's scary, and it's definitely something that everyone has to be aware of. So next slide. So the cyber threat is growing. The impact patient goes beyond data theft. There's a ransomware attack every 10 seconds. Successful attacks result in an average 15 days of downtime. Now, that's what I was talking about. That's really beyond what a downtime procedure is built for in any, healthcare environment. So you're not set up to be down for lengthy days like that. So it really has a tremendous impact on the, hospital's ability to do procedures, to operate, in their ORs is a big impact that I've seen in organizations that I know have gone, under attack through ransomware. But, the cost of healthcare, 6.2 billion in lost information. So that's everything from losing access to patient records, billing, losses, the cost to basically replace systems if you're not able to pay, or if you get, someone that's not legitimate and you pay the money and you don't get, your system back online. Luckily, most of the attackers are at least legitimate, that once you pay the fine, they do release the systems. They'll usually have a decryption code that they'll give you that you put in, because your screens will be taken over by a screen that basically says you've been compromised, and you can't really do anything on your computer at all. But once you put in this code that they'll give you, it releases it. But the loss is usually, for some organization, it's too big for them to handle and they close. But it's a lot, and 6.2 billion of lost information is a lot to handle. No access to required meds for patients. Life-saving surgeries on hold. You could be someone. We had to put. A lot of organizations during COVID, just through the pandemic, had to put certain procedures, on hold. And, some of them were important, surgeries that you would think you would need to do. But, when your systems are compromised to a certain level, you really can't operate efficiently if you don't have access to the data that you're used to having access to in the OR. You can't really do the procedure, and that could, have an impact on somebody's life. And I talked about implant devices. That's really something that's new, but it's, becoming a raised concern where, a lot of, we have an initiative called Hospital at Home that we're developing, which is basically setting up a patient that once they leave our facility, if they're transferred home, but they need to be monitored still, or they go to an LTAC, acute care, a long-term acute care facility, or a skilled nursing facility, which we call SNFs, that they're going there with certain technology that connects them back to our systems. So in that facility, we're able to monitor what care is being given to them. So they're getting, basically the care that's going on with them is being documented through a connection into our EMR via this, technology that goes home with them. And it allows us to keep an eye on the patient, both at home and if they're in, these aftercare facilities. And, it's a great opportunity to expand technology to help improve patient care, but it opens up a whole new, area for, compromise of systems and the threat of cyber to basically, have an impact directly on a patient. When you think about it, those are things that directly access the patient by your organization not being able to deliver care to them in certain situations that can be life-threatening, to them if they're waiting for a transplant surgery, perhaps, or some, a heart procedure that's critical, cancer, procedure, that those are all life-threatening things that, if your organization can't treat them, and if they're down for a length of time, like, average of 15 days is a scary figure. Think of, for any of you that work in healthcare, if you work at a hospital and you think of the system being down for more than a week, think about how you would be able to function, and if you'd be able to function at your full capacity, or if you'd be able to function at all. I would say most people would say no. We probably wouldn't, because we're using EMRs, and if that EMR was shut down for a length of 5 to 15 days, that would start affecting our ability to do procedures and get patients access to meds and things like that. So it's really important to understand the threat and the importance of having the right cybersecurity within your organization, or just on your home computer, having malware software that looks for patterns that are known out there, so at least it'll protect you from opening that message. It'll block it, move it to a spam folder automatically, or quarantine it, things like that can be done, because most of the ransomware that's out there, there's systems out there, like CrowdStrike is a big cybersecurity vendor that's based in the cloud now, and they use AI, and it's very interesting how they basically, if someone is attacked that's a customer of CrowdStrike, they look at that attack and they immediately, through their cloud and through their AI, basically share that information about that attack with every organization that is connected to them, so that organization can be aware of it and block it, basically from coming in. So, there's a lot of advances in technology that are helping with cybersecurity, but they have a big cost on them, and a lot of organizations haven't really understood the cost yet. That needs to be put into cyber protection, within an organization. You go to the next slide. So, really what it's all about is caring for patients, means caring about the technology they're relying on. We'll all experience a cyber attack. Some of you may have experienced it, and I'd certainly be interested if you want to share an experience with it when we go to the Q&A shortly. But it's preparing hospital workers with the tools and knowledge to anticipate, prevent, and recover from a cyber attack ensures patients can continue to trust us. And that's what it's about in the technology field. If you work in healthcare, I'm a firm believer that you have to be of a certain culture to work in healthcare, regardless of whether you're directly touching a patient. But even if you're working, the technicians that set up computers, I feel, need to understand how to prioritize things in a healthcare environment, different from if they worked in a bank or a manufacturing facility or some, organization that wasn't directly, caring for patients. So, it's just imperative that we understand that, that we have to protect that data of theirs that we're holding with the utmost, value, to ensure that they trust us and they know that, they're safe. And, you can only do that through education. A lot of the organizations you may be in do internal phishing campaigns, where they'll send internally emails that, are basically phishing emails, but they're not dangerous, because when you click it, they just get the information back that you didn't recognize that this was a cyber attack, and send it. Usually, we have a system where it's a blue fish icon that you can move an email into the blue fish, and it will basically look at it to see if it's spam, and it'll let you know. So when we send out the phishing emails, the users that recognize them as potential malware move them into that blue fish, and we get a report back. We know how many people and what, you know, areas they work in that might be the most susceptible. And it's not about reprimanding them about, you know, not doing it right. It's about focusing the education on them so they understand how to recognize, you know, emails that are not legitimate, and to, you know, to delete them or to get them to the cybersecurity department so that they can, you know, address the attack that may be, you know, being sent in them, so they can ensure that it, you know, doesn't hurt their organization, and share it with others, you know, to make sure that it doesn't, you know, affect others. So it's really important to understand the role that technology plays nowadays. It's a completely different environment than it was, like I said, back in the 90s when I started, and we were really just, you know, barely touching patients with technology. It's different today. It's a whole different world. And with EMRs being everywhere now, you know, that data is really the organization's lifeline to their patients, and to being able to care for their patients. So, you know, understanding and understanding, you know, the ways to protect yourself and your environment, you know, at work are of the utmost importance. So hopefully this presentation gave you a good or better understanding of, you know, the impact that cybersecurity has in healthcare, and that you know, basically will take back knowledge that will maybe have you reach out to your IT department and find out if they have a cybersecurity, you know, group, if you're not aware of one, and find out what they're doing to, you know, protect their environment, so you can be aware, you know, of, you know, the risk there, because that, you know, that can impact your job if they're not, you know, protecting things in a way that, you know, that meets, you know, current standards. So it's really important, and I hope you got some good information from that. I think there's the last slide. You go to the next one. No, but I think, yep, that's it. This is just one of the main resources that that were used there. But that's it. So we can go to questions now. Lindsay, I went a little bit over the 15 minutes, but Lisa,
Wonderful presentation, and we'll just wait and see what kind of questions we have, and I'll read
okay.
them up.
Somebody's got to have some questions out there. Don't be shy. It could be a comment too if you wanted to share something. Like I said, maybe you've been exposed to a you know, cybersecurity situation in your work, and you want to share that. That'd be great to hear.
Well, I guess I will start with a question.
Okay.
I am notorious for not changing my password enough, I think. Is there, how long do you think you should go between changing passwords on your?
You know, there's a HIPAA standard that most EMRs have to adhere to. That's 75 days. But I'll tell you that I'm not, you know, I'm more interested in your ability to pick out a malicious email than changing your password, because it's really, you know, it's really not too common nowadays that hackers are guessing passwords any time, you know, in the recent ransomware scenario. They're really coming in via email. So I'll give you 75 days, because that's a HIPAA standard that's put on, you know, organizations in healthcare to, you know, HIPAA is it's the Health Information Privacy Portability Act. And it's a set of guidelines to follow around securing your systems and interfacing with other vendors and things like that. And it gives 75 days to change your password. So I'll give you that, but I'll tell you that I'd be much more interested in your ability to recognize a malicious email that comes into your inbox over worrying about, you know, changing your password too much, because where they're getting in nowadays is via those email links that are, you know, links that look legitimate, but they end up installing something on your computer that, sits there for a length of time and then goes out and does its dirty work, which can be, astronomical to educational facilities, right? I'm sure if your, main system that you're using for connecting the classrooms were compromised, that would have a major impact in the ability to do, business. So I'll give you 75 days. It's a great question, but it's just not as important to me, certainly in the healthcare space, as being aware of how to spot malicious emails that come in, and being able to, check links. You hover your mouse over a link and you see what that full link is. And if it looks like something that is, just a bizarre link that, again, like I said, ends up with a dot, CH or RU or just some other country, that's a sign to be cautious and probably not open it. It's probably not from your bank or from a local organization. So the answer I'll give you is 75 days on password changes is a HIPAA guideline. It's a good practice, but it's certainly more important to be knowledgeable of identifying malicious emails that come in nowadays. That's the big way that people are getting systems compromised. And it's at home too. I've had a lot of doctors that have called me from home and they said, hey, I got a call from Microsoft that said I had a virus, and they would remote in and fix it. And they basically remote in and they deploy their software that basically locks the home computer down, and they want, $1,000 to open it up. And I had it happen to several, docs a few years ago where, they got suspected, compromised to it. Now, luckily, they didn't have much that was on their laptops and their home computer that they were willing to just reinstall everything from scratch. But that can be something that affects you personally as well as at work via those bad email links. Welcome.
So we have another question. This is from Urmila. She said, you did such an amazing job and covered most of the concerns. What do you see as the future steps in cybersecurity in healthcare?
That's a great question, Urmila, and thank you. It's always a pleasure working with you. Urmila and I have been worked at several teaching facilities, and I've known Urmila from Cleveland Clinic as well. So yeah, it's a great question. And I think a lot of, the protection is going to the cloud. So vendors like CrowdStrike, SentinelOne is another big cloud vendor out there for security. So I think, having that, I think it's an area where the cloud has the ability to protect environments in a better way, because they can watch, things more broadly, and they have, specific modules now that they deploy that are specific to looking at, your smart machines. So, where a lot of things transitioned, Urmila, where, once everybody got EMRs up and they got, general security around that, all the modalities that were sitting around in organizations that were feeding information into those EMRs, right? Your portable, blood pressure machines, and all types of machines that were now, smart enabled. So they were connecting to the network because they were either sending data to a centralized repository, maybe a central server that lived in the environment, or they were sending things to the EMR. We have smart what would you call them? But, they're in that patient room, and they, it's where they hang the medication from. And those are now smart units where they have a database where they look at the drugs that are being added on to that patient, and they look for conflicts, which is great because, the number of people that die from drug where one drug has a bad effect. If you're on one drug and you take another drug, there can be a bad interaction between those two. And being able to recognize that is something the computers do much better than a human can do. So, being able to protect a lot of those devices are now, where a lot of organizations are focusing, and those cloud vendors that have the ability to deploy their modules that run on those systems, and they run with small footprints, so they don't take up a lot of space or memory. They don't really affect the operations of that device, because many of them are, they're running a closed version of a Windows operating system just with minimal memory to just do the functions of that machine. So you can't load, extensive, like, Norton antivirus software on them. They're not built for it. But, the cloud vendors and the good ones out there, they've developed modules that can run, that talk back to their central system that monitors those mobile devices and, allows you to protect them much better. And that's where things are going, I think, is more around the smart devices. And we talked about the implants at the end. I think, you see the commercial that's on every station nowadays with the, the blood glucose device that plants on your arm, so you don't have to prick yourself, and you basically hold it up to your smartphone and it tells you what your blood glucose is. And those, those go back, they feed databases within that vendor's main systems that, folks like endocrinologists in our environment connect to through our EMR. We have connections into those systems, so they pull those in. They can see when you had a spike in your blood, sugar, just as you did while you were out on vacation, and they can note that. And when you come back, talk to you about it. Maybe you need to change your eating, or you had some meds that were, affecting it and they need to be changed. But those are all things that nowadays are advancing very greatly. But, the need to protect them is becoming more and more recognized by more organizations. So that's kind of my answer to that, is really it's going to the mobile environment, where both, devices inside your environment that are mobile but are running computers on them that connect to the network, but they're not really thought of as computers, because those computers just are servicing the imaging system, right? They're not, think of it as something that can be compromised. But if it's a device that's running any form of an operating system that gets an address on your network, the ransomware attackers have the ability to, if they compromise that device, they've got access to your network now. They can learn your network through techniques in their, software that allows them to figure out what your networks are internally and find out where the key systems are and go and attack them just by getting into a mobile device that you wouldn't even think of had an operating system on it. But it does nowadays, because they're all smart. They all have the ability to usually talk wirelessly or, transmit data back via the network to a central system, like monitoring systems, and things like that. So those are all new areas that are, being addressed by cybersecurity today.
Great. And it looks like we have time for one more question, I think, one or two. This is from Lindsay. She says, "Thank you for this presentation, John. You provided many great examples, some of which I wouldn't have even considered. It was scary to hear about implanted medical devices being hacked. Are you seeing two-factor authentication being implemented more in healthcare?"
We are, Lindsay. That's a great question. And that's a great way, to really add a layer of security that, that's really not a lot on the user. So, so what we're using now for that second layer is our badges. So, you can use the badge to log yourself in. So, you don't have to remember all of that information. But, for that second layer, if you're going in and going to prescribe a drug or something like that, then you have to put in a password as a second authentication to prove it's you. So there's lots of that going out there. And there's, things you probably have them. I know it's, some of the schools that I taught at, they would have, a remote authenticator product that runs on your smartphone that spits out a number that is a random number. And when you're logging in remotely, you have to use your password and that number to get in. So yeah, two-factor is a big big, a big helper in protecting it. It helps ensure that the right people are getting in. It doesn't really help from the phishing campaigns as far as, you not clicking a bad link in your email, but it definitely helps ensure that in certain scenarios, the true person that's supposed to get into that system or that specific information gets is the one that's requesting it, right? So if somebody just has your badge, they stole your badge, and if you have a badging system, well, you can get in, but to do anything like place an order or anything like that, you've got to also enter in a password, and that is something that helps protect to ensure the right people are getting into the data, which is a big part of of securing things. It's a big piece of it. So it's a great question, and it is a very important technology that you're probably seeing. If you're not seeing it today, it's probably something that would come to your organization, especially if you're in healthcare, because a lot of that critical data, two-factor authentication is required to get into it. We're just trying to find ways through the badging, access and that to make it easier for the clinicians to do it. But it's still something that is prevalent out there, and it's a growing technology that that a lot of organizations are adapting, and it helps. It does help a lot to making sure the wrong person isn't getting into that information and potentially doing something with it, because a lot of, just like the emails come in, most organizations are compromised internally. So it's an internal employee that prints out records and is sharing them with somebody that's paying them, and they're doing insurance fraud with them. So it's a lot of it comes from the inside, and with the phishing campaigns now, that's a big gap. That's like I said, a lot of organizations are doing phishing campaigns where they're trying to run them through the internal organization to see people that are basically not understanding them correctly and providing education to them. It's not about reprimanding anybody for doing it. It's about providing them the right training to understand how to look for the obvious signs that are out there with bad emails, but they're not obvious if you don't know to look for those true things, like just hovering over a link so that it'll display the full link before you select it to see, is it really linking back to the organization, or just knowing the type of information that someone would ask you for is not something that would be entered via an online form or something like that. It's a lot of that, but great question on the two-factor. That's important one that helps ensure the right person is getting into the right information.
Okay, so very quickly, there's one more question I think it's important to ask, so I'm going to go ahead and go over a little bit. Okay. So this is from Deborah Blackwell, and she said, I enjoyed your presentation, John. A community college in my area was a victim of a ransomware attack. The city PD had a cyber crimes unit that investigated the attack along with the FBI and the Department of Public Safety. Is there a similar process used in healthcare to investigate these issues?
Well, like I said, they're definitely, the FBI is definitely connected with healthcare, and they have, we have agents that work with us specifically to share threat information that they know about. And then obviously if we, find something on our system that we're, luckily we've been able to detect any malicious, software that's hit our system before it's had a chance to do anything of major harm. And we share that back with the FBI, but they're the biggest partner, I can tell you, in healthcare that I know has a specific branch that focuses on cybersecurity in healthcare, and they're global, right? So they're in touch with all other countries, and so the information they get and they're able to share is really valuable to us as a healthcare organization. And if you want, I don't know if my email's on here, but I can definitely, Irma, I can definitely get you my email. If you want to know, there are some groups that you can join that are local groups, depending on where you live. Most of them have divisions all over the country that can help show you, engage you in cybersecurity a little more and give you access to some information that, may be interesting if you're interested in it. So I'd be happy to share that with you if you want. But, my main answer to your question is the federal government, the FBI, they're big partners in linking the healthcare and keeping us aware of major threats that are out there. And also, us sharing with them information that we get through internal threats. Yep. No, if you're in Irmela's class, she knows my email address. You can get it from her, and I'll be happy to share that with you. Good question. Good question, guys.
Wonderful, John. We just want to thank you so much for taking the time to do this presentation. We really appreciated it. And we appreciate everybody coming and asking questions and getting involved. If anyone was unable to get their question answered or thinks of a question after this is over, please go ahead and email them to continuingeducation@snhu.edu, and we can get you hooked up with John for further questions.
Definitely. Happy to do that.
And then everyone needs to fill out the evaluation. So you can do that in two ways. You can actually go to the Ethos CE platform and you'll be able to do your evaluation right there. We have also put the evaluation in the chat, so you could go and do it that way. And that has to be completed by October 19th. And you will have access to your certificate once that evaluation is complete. And if you have any questions, feel free to reach out to continuingeducation@snhu.edu. And we will have a recording of this session available within the next few weeks. So
Great.
Thank you, everyone. Thank you, John.
You're welcome. Yeah, thanks, everybody. I enjoyed the presentation. Glad you enjoyed it. And as Lisa said, if you have any questions for me or want to find out more about, how you can engage in cybersecurity in your local community, just reach out and I'm happy to share some information with you that will connect you. So thanks again, everybody.
Bye. Have a good night.
Yep, you too.